Do you have bladder pain and feel like you have a constant UTI? Well, you may have interstitial cystitis, so stick around so I can inform you what it is and how to treat it. Welcome to Women's Healthcare Answers, and this is Jeff McQueary, a Tennessee gynecologist. I want to focus on you, especially if your gynecologic problems are dominating your life and you want to take back control. You can solve your problems with answers and solutions I will give you. So what is interstitial cystitis? Well, it's also known as bladder pain syndrome, and for short we call it IC. I'm going to refer to it several times like that. And it's a painful feeling with burning just like a UTI. So please stay until the end to learn how to treat interstitial cystitis. It's not always done right. So typically, if you've had these kinds of UTI symptoms and they have lasted for more than 6 weeks, you may have IC. But you are not alone. About 8 million women in the U.S. have IC just like you. But men and even children can get IC. Often you will have gone to the doctor, the urgent care, or even the emergency room if it's severe enough. If they diagnose you initially with a UTI, but then the culture comes back with no bacteria, especially if this happens to you over and over again, you may have IC. So there are many levels of symptoms as well, and it can be mild. It can come and go, known as flares. That happens especially in the beginning, but can get even more severe over time, leading to scarring, persistent pain, and very small bladder capacity. So I'm going to ask you some questions, and if you have a yes answer to any or all of these questions, I'm going to ask you, you may have IC. Do you have pain in your lower pelvic area? Do you have pressure on your bladder? Do you go to the bathroom very frequently and urgently? Do you get up at night to have to go to the bathroom and you didn't used to? Is sex painful for you, especially burning afterward? Have you had multiple urine cultures without bacterial growth, even though you have all the symptoms of a UTI? Did you have symptoms not resolve after antibiotics? Are you getting frustrated with all this persistent bladder pressure and pelvic pain? Certainly, if you answered yes to any of these questions, I think interstitial cystitis could be a diagnosis that helps explain your symptoms. So please listen. Let's take a step back and understand how your urinary system works. You have 2 kidneys which filter the blood of toxins and then drain that urine into what's called the renal pelvis. This is the collecting area on the side of the kidneys which connects them to the ureters, which are the tubes that go all the way down to the bladder and drain the urine there. The bladder is nothing more than a holding vessel. The bladder is quite amazing though, because it can typically hold urine for long periods of time without really increasing the pressure inside. But when the bladder has reached the appropriate fullness, and when you have decided it's the appropriate time and place, not in public hopefully, then you empty your bladder through the urethra. Well, if that's how the urinary system is supposed to work, why do some people have problems with pain in their bladder if it typically holds so much volume without any problems at all? Well, that's what we're going to try to answer for you today. So how does IC even happen? Well, there is inflammation of the bladder wall. We know that. We just don't know exactly why it happens. And cracks or weaknesses seem to form in the bladder wall that appear to happen, and that allows toxins and acids to inflame the bladder lining. But it's also proposed that inflammation is caused by mast cells. These are histamine-containing cells. This is where we think there is an allergic reaction in the bladder wall. But some people have an increased sensitivity of the nerves in the bladder, and this leads to pain with filling and distending the bladder. So there could also even be an autoimmune component to IC where your body is attacking itself. But interestingly, there may be even a genetic component to this, especially when family members have had similar type symptoms. And they may have never even been diagnosed. but it's also felt that multiple bladder infections could also damage the bladder wall and lead to these type of symptoms. So there's multiple different ways that this could have formed. Your gynecologist can possibly treat these type of problems, but you may want to go to a specialist which really specializes specifically in urinary issues, such as a urologist or urogynecologist. But if you go to a specialist, they're going to do specific tests on you. Of course, they're probably going to get a urinalysis and urine culture, but they may want to do a cystoscopy, actually looking at your bladder and seeing the inflammation. Because of all the urgency symptoms, they may even consider urodynamics, which is a study of how your bladder functions. So if you like this video so far, hit the like button. It really helps with YouTube. And please subscribe, because if you miss any of my new medical videos coming out every week, who am I going to talk to? Just give me a thumbs up. And please comment. So back to the information you want. What can we do to treat interstitial cystitis pain? Well, the first thing you need to know is there are no one-size-fits-all treatments for interstitial cystitis. It is really a treatment for symptom relief and not necessarily a cure. So we often initially have to start an IC diet, which is eliminating certain foods from your diet that cause irritation. These foods, such as citrus fruits, tomatoes, chocolate, caffeinated beverages, yes, coffee and tea, alcoholic drinks, especially red wine with its tannins, spicy foods, and some carbonated beverages, especially colas, can cause a lot of irritation. And even vitamins and supplements can cause problems, such as vitamin C, which we use when we have a cold, and L-arginine, an amino acid in protein supplements that can sometimes help, but has been known to also make IC worse. But the main thing to remember is not all these food groups or supplements affect everyone the same way. So it's very important to see what is really affecting you. Typically, I have patients put this list of bladder irritants on the refrigerator and refer to it when they've had a bad day. I will make that list available to you along with the IC information, so check out the description after the video. I had a patient once that was affected only by apples, and her family had got bushels of apples, and they were having some sort of apple dish for breakfast, lunch, and dinner. Once she decreased the apples and eliminated that for a while, she did well. So the problem can be very isolated to even one of these things. But also, things that can help is pelvic floor physical therapy. It's often because muscle contractions from pain lead to its own pain directly associated with the bladder problems. This is why interstitial cystitis is called bladder pain syndrome, because there's a lot of other things that happen. And it can become chronic disabling problem that affects other areas in your body. But the pelvic floor physical therapy can help tremendously to relax the pelvic floor. So Kegel's exercises are not good because they strengthen the floor. The key is pelvic relaxation. So what medications help interstitial cystitis? Well, NSAIDs such as ibuprofen or Aleve can help with the inflammatory discomfort of IC. Amitriptyline, which is a mild antidepressant, may have multiple effects, including acting as an antihistamine, decreasing bladder spasms, and maybe even slowing the nerves that cause pain to decrease that pain sensation. Another medication is oral pentosan polysulfate. This is also known as Elmeron, and can restore the protective lining of the bladder. But I often don't use it because it can be prohibitively expensive for most people. Another option is hydroxyzine and cimetidine. They're both cheap. Both of these medications have antihistamine effects, and you may notice cimetidine is a stomach medication, so you can treat your reflux and your IC at the same time. Are there natural therapies that can treat IC? Well, there's a medication called Preleaf. This is over the counter, and it's calcium glycerophosphate, and it can decrease the acidity of foods that you may want to eat but normally can't. Glucosamine chondroitin is a combination often used for joints. Quercetin, which is an aloe, are herbal supplements that can potentially decrease inflammation in the bladder, so all these things can be used. And drink a lot of water to wash the bladder out. Hopefully that will help to decrease inflammation. And stress affects everything. So decreasing stress and fatigue, you may even seek therapy for this. And I even read an article that acupuncture has been shown some promise in actually treating IC. If all this doesn't completely help with IC, then what? Well, installations with heparin, lidocaine, triamcinolone, or DMSO, and potentially even a combination of these, can be used for treatment. This is putting medications through a catheter directly into your bladder to decrease the inflammation and even promote healing of the bladder lining. We do these treatments all the time in my office with a lot of success. But we also may do cystoscopy with hydrodistension under anesthesia, stretching the bladder and increasing your bladder capacity and possibly even cauterizing ulcers and atypical vascular areas to help with the urgency and pain. Botox can also be used, and it can paralyze some of the muscle fibers of the bladder and can partially relieve the pain and urgency of IC. But if all else really fails, we have something called, big long name, sacral neuromodulation. And this is an implanted pelvic, bowel, and bladder nerve stimulator, and this can really help. There are two main systems, axonics and interstim, and these systems deliver small electrical impulses to help the brain and bladder to communicate better, giving you relief of urgency and potentially even some pain relief. There are also research studies you can enroll in that are studying new medications that could help IC if nothing has been able to help. But the big problem with IC is there is no long-term cure. There are just treatments to relieve symptoms. You should try any, if not all, the treatments that we have mentioned and stick with them if they work, because they really do help. Talking about bladder irritants, try to avoid the foods that irritate you, but you can't do that all the time. So taking an acid reducer such as Preleaf with these foods can really help. But just discover the things that make your interstitial cystitis worse, avoid the things that cause you to have problems, and work within your body to discover how it functions best. But the most important thing is to get a doctor such as a urologist or urogynecologist who can help you get a full diagnosis and a treatment plan so you can have a better quality of life with less pain. So hopefully you feel you learned something today. And as always, I've enjoyed being here with you. I would love to help you solve your problems at Women's Healthcare Answers. Remember, this video is meant for information purposes only. Please consult your own healthcare provider, but it's okay to reference the information I gave you.